So first we have our instructions here. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing, 2 actions the nurse should take to address that condition, and 2 parameters the nurse should monitor to assess the client's progress. You might see here this keyword, this most likely. So that's really important because with all the information that they're going to give us in the data tabs in this scenario, any of these conditions are possible. Any of the actions to take are possible things or things that we would do, and as well as the parameters to monitor. However, it's the things that we're most likely doing for this condition or the most likely condition that the client has. So what are the findings telling us? All right, let's take a look at this together. So for here, our data tabs, we have progress notes and we have lab results. So as I read through this, I want you all to consider what's normal, what's abnormal, what's expected, or what are we concerned about. Client delivered a healthy baby 3 hours ago, placenta intact. The uterus is boggy and 1 finger breadth above the umbilicus. The client reports mild perineal discomfort and is feeling too tired to hold and feed her newborn. Lochia rubra noted on the peri-pad, saturation of 2 pads in 2 hours. Okay. So next, let's look at our lab results. So it looks like everything is in normal range. We have our reference range is all here. It looks like everything's on the low end, but they're still within normal limits. Okay, so what do you all think? We're going to do this recognizing cues. What do you see that was concerning? What do you think is concerning when you first look at this, the progress note, or if you thought anything was concerning in the lab results? Any ideas? What do we think about the uterus is boggy? Are we concerned about that? Yes or no? Yeah. So I see, great job, that boggy uterus. So we're concerned about that because the uterus should be what? It should be nice and firm. Boggy equals bleeding. Just think of that, B&B, boggy equals bleeding. So that's not good. What about the location? We have 1 finger breadth above the umbilicus. Where should that uterus be right after delivery? Yeah, Meg, great. You said the uterus is above. Absolutely. So it should really be at umbilicus, at U or lower, right after delivery. It'll start to kind of refill with some blood a little bit after an inflammation happens, but right after delivery, we should at least be at U. So it's above the umbilicus. So it's up a little higher. I see, great job. I see the saturation of the peri-pads and the bleeding that we're having. So we are concerned about that as well because that's excessive bleeding, right? We should not soak up peri-pad in an hour, and that's what this is equivalent to. So we have some very heavy bleeding. Are we worried about anything about, what do we think about she's feeling tired, too tired to hold her baby? Or about the perineal pain. Is that pain mild? Perineal pain, is that expected? Oh, I see people taking guesses that we think the bladder might be full. Okay, definitely. When that bladder's full, it's going to push that uterus up. What do we think? Are we worried? We expect to have that mild pain, right? She just had a baby. Yeah, normal, Posh. Good job. So, and then feeling tired. I mean, she just had a baby, right? She should be tired. Definitely, yes. Pina is expected. Exactly. Okay, and I don't see anyone being concerned about her lab results, and I'm not either. Those lab results are all within normal limits. Definitely something we might want to watch.